get a picture of his eye the way Dr. Fry sees it through the microscope. It's magnified there anywhere from between 30 to 50 times. Dr. Fry is going to start with a side port incision. This is a 1 millimeter incision. It's about the size of a needle point, and that will act as an access point for various instruments during the surgery. He's going to add some lidocaine. That's a topical anesthetic or a numbing agent that will numb the inside of Harold's eye. This is a thick viscoelastic gel. It protects the cells of the cornea during the surgery. There are corneal cells that don't regenerate if they're damaged, and this gel acts as a protective cushion for them. Dr. Fry is going to make his main incision. This is called a clear corneal incision. He'll go underneath the cornea, which is the clear front window of the eye, and into the anterior chamber, or the front portion of the eye. He's going to be removing the natural lens and replacing it with a lens implant. The lens has become cloudy and hard to see through, and we call that a cataract. The lens is completely surrounded by a thin membrane called the capsular bag. In order to remove the lens, Dr. Fry will have to open that capsular bag. He made a little puncture in the front of the bag. He's making a circular tear around that front portion. He's going to leave the back and sides of the capsular bag intact, and that's what will hold the lens implant. You'll see them just moisten the surface of the eye from time to time, just to keep Harold comfortable. This is a procedure called hydrodissection. Dr. Fry is adding a balanced salt solution between the lens and backside of the capsular bag. He wants to loosen that lens so that when he removes it, he can keep the capsular bag intact. He's going to use this instrument at the side to rotate the lens and just confirm that he does have it loose. Moisten the surface of the eye again. This instrument's called a phacoemulsifier. This is what Dr. Fry uses to remove the lens. It has ultrasound at the tip that vibrates, and that will jar the lens, and it breaks the lens into pieces. The pieces of the lens are then vacuumed out through the silver tip of the instrument. The holes in the sleeve of the instrument are replacing fluid to the eye at the same rate that the pieces of the lens are being vacuumed out. And that keeps the volume and content of the eye the same at all times. Dr. Fry will just work down through the center of the lens.
Line 1, Sylvia, line 1.
He's going to use that instrument at the side to pull the lens apart. And then he'll rotate the lens and break it up into several smaller pieces. This part of the lens that he's removing is called the nucleus. That's the thicker part of the lens. It contains cells that have been there since Harold was born. The lens of the eye started out very soft and clear, with about 1/4 the cells there that are there now. As new cells formed, they pushed the older cells towards the center of the lens, and they began to get compacted there. The lens eventually got thick and hard, and it discolored, and we call that a cataract. Dr. Fry has all of the nucleus part removed, and what's left there is called the cortex. That's a thinner, softer layer of the lens. It's the newer cell growth. He'll use a different instrument. This is called a 0.3IA tip. The hole in the tip of that instrument is just 3/10 of 1 millimeter in diameter.
Right.
That's what does the vacuuming away of the cortex. And the holes in the sleeve replace fluid to the eye, and that keeps the shape of the eye intact.
He's breathing easier than he was.
So how many layers do they actually take?
Actually, you're just removing the 2 layers, the nucleus and the cortex. He does make that circular tear in the capsular bag, but he doesn't really remove the bag, just that front part. So
Wow.
he's got the lens completely removed. He'll use this instrument called a squeegee to clean the back side of the capsular bag. You'll probably be able to see some wrinkles there as he moves across it. That's the back of the bag. He'll add more of the viscoelastic gel. That will expand that bag and makes it easier to put the lens implant in. And the implant is inside this insertion tube. As it starts to come out of the tube, you'll see a plastic loop. Then there's the round portion that will begin to unfold as soon as it gets out of the tube. And then there will be another loop. Those loops are called lens haptics, and they attach to the sides of the capsular bag, and that's what holds the implant in place. The round portion is the lens optic. It does have a power in it that is similar to the natural lens, and they took the measurements for that at the clinic. Dr. Fry is going to use the 0.3IA tip again to remove that gel. The gel is thick enough that it can cause a blockage to the eye's drainage system, and then that can cause increased pressure in the eye. So he wants to remove as much of that as possible, and then they do the pressure checks after the surgery to be sure that the pressure is okay. Dr. Fry will hydrate his incisions. This will cause a little swelling in the cornea temporarily. It seals the incisions. They'll heal from the inside out, so there's no need for sutures. He's going to check the pressure of the eye with his finger. He'll use an antibiotic solution. It's all finished.